Hello everyone. Today we will be presenting our health teaching project that is intended for adults with hypertension. This presentation was conducted by the University of Illinois at Chicago College of Nursing students. My name is Angelica.
My name is Trinity.
My name is Julie.
The objectives for today go as follows. After the presentation, the audience will be able to identify two common risk factors associated with hypertension. After the presentation, the audience will be using a 0 to 10 scale to rate their willingness to implement an exercise regimen into their life. And finally, after the presentation, the audience will be able to identify at least two healthy food options when managing hypertension. The following slides will include pre-survey questions the audience will answer to the best of their knowledge so that we can assess your prior knowledge on high blood pressure. The first question is, true or false? High blood pressure can be managed through healthy dieting, proper use of medications, and exercise. Please take a moment and pause this video to answer this question before moving on to the next slide.
The second question is, using a scale from 1 to 10, 1 being you are not willing at all and 10 indicating you are completely willing, how willing are you to start an exercise routine? Please take a moment to pause this video to answer this question before moving on to the next slide. The next question is, what are some healthy food options to manage high blood pressure? Again, please take a moment to pause this video to answer this question before moving on to the next slide. The fourth and final question is, what are some risk factors for high blood pressure? Please take a moment to pause this video to answer this question before moving on to the next slide.
Before we begin the presentation, we included a definition of health. According to WHO, health is defined as a state of complete physical, mental, and social well-being, and not merely the absence of disease. To begin the content, we'll define what is blood pressure. Blood pressure is the force applied by the circulating blood against the walls of the arteries. Systolic, which is the upper number, shows the maximum pressure in the arteries when the heart squeezes. Diastolic, which is the bottom number, shows the pressure in the blood vessels at times the heart is at rest between beats. Here are some statistics about high blood pressure. Having hypertension puts you at risk for heart disease and stroke, which are leading causes of death in the United States. Hispanics are more likely to have undiagnosed, untreated, or uncontrolled hypertension than any other race, ethnic group in the U.S. Among those recommended to take blood pressure medication, blood pressure control is higher among non-Hispanic white adults than in non-Hispanic Black adults, non-Hispanic Asian adults, or Hispanic adults.
Hypertension is the medical term for high blood pressure. mmHg is the unit of measurement for millimeters of mercury. The American Heart Association defines high blood pressure as a systolic blood pressure greater than 130 mmHg and a diastolic blood pressure greater than 90 mmHg, also known as millimeters of mercury, measured on 2 consecutive days. Heart disease such as high blood pressure is one of the major contributing factors to morbidity and mortality worldwide. Here are risk factors for high blood pressure. According to the World Health Organization, modifiable risk factors, which are actions you can take to reduce the risk of high blood pressure, include an unhealthy diet, which include food content high in sodium and fat, and low intake in fruits and vegetables, being physically inactive, being overweight or obese, consumption of alcohol, and smoking. Non-modifiable risk factors, which are things you cannot change that increases your risk for high blood pressure, include a family history of high blood pressure, being ages 65 and over, and or having multiple comorbidities, also known as multiple chronic illnesses, such as diabetes, hyperlipidemia, also known as high cholesterol, and coronary heart disease. Foods to avoid with high blood pressure are canned foods with preservatives, fried foods such as fries and fried meat, table salt, chips, pretzels, pork such as bacon, ham, and sausage, frozen TV dinners, and processed meats.
Some diets we would recommend to consider in one's diet would be food items that are low in salt, food that is not high in saturated fat and trans fat, any types of fruits and vegetables, and we would recommend an increase in potassium intake. Potassium foods include potatoes, bananas, leafy greens, nuts, and dried fruits. Some ways to control and prevent high blood pressure is to be physically active. We recommend exercising about 2 to 3 times per week. The exercise does not have to be high in intensity. It can be as simple as taking a walk in the park or going for a run. Consuming high-quality, nutritious foods and getting adequate sleep every night will give your heart a better chance to pump effectively. Adults should aim to sleep 6 to 8 hours per night. Some other factors include reducing and managing stress, reducing your alcohol consumption, and to avoid or better yet quit smoking. Regular blood pressure checks and screenings are recommended to monitor your blood pressure. Taking your blood pressure medication as directed by your doctor is very important. And finally, monitoring other medical conditions you may have is essential in making sure your blood pressure does not worsen. Some common signs and symptoms of high blood pressure include chest pain. If you are experiencing any chest pain, please, it's very, very important to call 911 immediately or have someone take you to the nearest ER. Some other signs and symptoms include headaches, nausea and vomiting, irregular heart rhythms such as palpitations. In other words, if you feel your heart is beating fast or racing, anxiety, vision changes, muscle tremors, and fatigue.
Once again, call 911 or have someone take you to the nearest emergency room immediately if you are experiencing chest pain that lasts longer than 5 minutes and does not go away with rest or the use of medication. Chest pain can be life-threatening. Here is some complication of uncontrolled hypertension, a stroke. High blood pressure can cause blood vessels to narrow, rupture, and/or clot, therefore blocking blood flow to the brain. Heart attack. Blood and oxygen supply to the heart is blocked, leading to damage to the heart muscles. Heart failure. The heart is unable to pump adequate blood supply to the organs. Both a heart attack and heart failure can cause sudden death. This is why it's important to manage and control your blood pressure. Why is this important? Early detection means early treatment. Routine blood pressure checks can aid in early detection, allowing for early health management of blood pressure. The overall goal is to educate adults with high blood pressure about the importance of hypertension so that we can work towards healthier outcomes. Health management and maintenance is key to allow individuals to live their ideal quality of life.
We have included resources and handouts on what high blood pressure is, as well as how to reduce high blood pressure provided in both English and Spanish. The links to these handouts will be added in the video description. Here are the takeaways. The first takeaway is that hypertension is a diagnosis when the systolic blood pressure is greater than 130 mmHg and the diastolic blood pressure is greater than 90 mmHg. The second takeaway is that there are modifiable risk factors to prevent complications of hypertension, such as reducing consumption of fried and fast foods. The third takeaway is to call the provider immediately if you are presenting with one or more signs and symptoms of hypertension. If you are experiencing chest pain, call 911 right away. The final takeaway is that there are several non-medical ways to reduce and manage hypertension, such as maintaining regular physical activity. In conclusion, hypertension is a major health concern because it affects the heart's ability to properly pump, leading to major heart conditions. Hypertension can be properly managed with exercise, healthy food choices such as maintaining a diet with low salt intake, and proper use of medications. Properly managing hypertension can help one live an overall healthy lifestyle.
Now we are going to go back to the 4 initial questions we mentioned in the beginning of this PowerPoint. This is just to test how much knowledge you guys have learned throughout this presentation. The first question is, true or false? High blood pressure can be managed through healthy dieting, proper use of medications, and exercise. The second question is, using a scale of 1 to 10, 1 being not willing and 10 completely willing, how willing are you to start an exercise routine?
Question 3. What are some healthy food options to manage high blood pressure? Question 4. What are some risk factors for high blood pressure?
Now we are going to go over the answers to the post-survey questions. For question 1, the answer is true. High blood pressure can be managed through healthy dieting, proper use of medications, and exercise. These behaviors will lower blood pressure and prevent future adverse events by decreasing the workload of the heart and increasing blood flow to the vital organs. The answer to question 2 will vary based on your own opinion, but hopefully after the presentation, you are willing to start and implement an exercise routine to your life. Exercise makes the heart stronger. A stronger heart can pump more effectively by applying less force on the arteries, ultimately lowering blood pressure.
For question 3, some healthy food options that can aid in managing high blood pressure includes fruits, vegetables, whole grains, foods low in salt, because that decreases the pressure on the arteries, which will therefore lower blood pressure. To review question 4, some modifiable risk factors for high blood pressure includes unhealthy dieting. That's a diet that's high in sodium, high in fat, low in fruit and vegetables, decreased physical inactivity, smoking, being obese or overweight, and the consumption of alcohol. Some non-modifiable factors include a family history of high blood pressure, being 65 years old or over, and having comorbidities such as diabetes, hyperlipidemia, which is high cholesterol, and coronary artery disease. All these factors alter the normal integrity of the arteries within the heart system, resulting in higher force exerted on the walls of the arteries, which creates higher blood pressure.
We wanted to give a huge shout out as well as acknowledge and thank the UI Health 55th and Pulaski Health Collaborative staff for all their support and guidance in this project.
Here is information about the UI Health 55th and Pulaski Health Collaborative. We have included the location, clinic hours, contact information, and website link. Most staff and providers are bilingual, and translation services are provided upon request. Here are the references that we have used to supplement the information we have provided in our health teaching presentation today. This is the continuation of our references. Thank you guys for listening to our health teaching presentation today. We hope that you guys have learned the importance of managing hypertension and that you can implement some of the lifestyle recommendations that we have discussed in today's teaching presentation. Let us know if you guys have any questions.